I'm Dr. Manoj from Kaveri Hospital, Chennai, and now we have a new molecule, Bempedoic acid, with us to help us treat these patients with hyperlipidemia. And all along we have been faced with many challenges of how to get this LDL to the goals in the various risk categories of patients with atherosclerotic cardiovascular disease. You first have to risk categorize and then note down what is the LDL goal levels. It is understood from various registries and also global surveys that almost less than 30% of patients, if you see the Da Vinci study, about less than 35% of patients receiving appropriate dose of statin get to the LDL goal level. So there is a significant gap in despite giving a high intensity or appropriate intensity statin therapy, the patients still have a residual high levels of LDL, and this can be brought down by various combining technologies with non-statin therapies. In the non-statin therapies, you have the ezetimibe, you have the PCSK9, and now the novel kid on the board is the bempedoic acid. Bempedoic acid is orally taken once daily at 180 milligrams per day, and patients who are either statin intolerant or statin is not allowing their LDL to reach their goals, patients can take this and try to achieve a much further lowering of LDL-C. The trials are combining with the bempedoic acid alone with the ezetimibe combination can bring down the baseline LDL levels in a statin intolerant patient by almost 23 to 24%. And if you combine with the statin plus bempedoic acid and ezetimibe, you are able to achieve the LDL to less than 70 in about 92% of patients. So bempedoic acid clearly has a role in those who cannot achieve LDL-C to the goal levels despite the tolerated statin or appropriate intensity statin dose, or in those who are really intolerant to statin and then consider bempedoic acid in combination with the ezetimibe. We certainly know that PCSK9 is a very, very effective technology and a medicine to bring down the LDL-C level. But this PCSK9 is an injectable, expensive, and even people who can afford cannot sustain the therapy because these are chronic lifetime therapy and has to be given continuously as long as the patient is alive. So therefore, bempedoic acid has a clear future in combination with statin or as a standalone in combination with ezetimibe for bringing down the LDL-C and reducing the further residual risk in the patients who have atherosclerotic cardiovascular disease. Thank you.